I'm Dr. Green with Seaview Orthopaedics. I'm an orthopedic surgeon that specializes in disorders of the foot and ankle. An Achilles rupture is actually a fairly common injury, and it's where the Achilles tendon fails and actually breaks into two separate pieces. It characteristically happens in what we call the watershed region of the Achilles tendon, which is 4 to 6 centimeters above the calcaneus. In reality, that region is an area that has very, very poor blood supply, about 4.5 centimeters above the heel bone or the calcaneus. Generally, people will have some prodromal symptoms or symptoms prior to that, where they feel a little bit of achiness at the Achilles, which means that they have some pre-existing Achilles tendonitis or disease. We generally see this in a very, very specific patient population. We tend to see it in slightly aging to early middle-aged males, but also females who are doing irregular athletic activity, basically your weekend warriors, which is very, very much characteristic of this injury. This injury does need treatment and is often frequently missed. People who rupture their Achilles have a very, very common series of complaints. They will hear a loud snap that may actually be audible to others. They will also feel as if they have been kicked by someone behind them or shot with an arrow or hit with some form of a stick from behind, but there's no one behind them. Treatment options for Achilles tendonitis are both surgical and non-surgical. From a non-surgical perspective, patients who do not want to undergo surgery are placed into a cast with their foot pointing all the way down. By plantar flexing the ankle, what that does is that brings the two ends of the Achilles tendon together so they can start to heal and mend together. Over a course of 6 to 8 to 12 weeks, that cast is generally dorsiflexed, or the foot is brought up to try and get the Achilles tendon out to a normal length, because it would be contracted or very, very tight if left in the plantar flexed or down position. The issues with non-operative management is there's a very, very high risk of re-rupture. Most studies have shown that it's about 33% or a third have a risk of re-rupture after non-operative management. From a surgical perspective, which is what we really do recommend at this point for anyone who is young and healthy, and by young and healthy that extends now into even early to mid-70s, is some form of surgical repair. Traditionally, surgery was a large incision that had trouble healing. The Achilles does rupture because it does not have a great blood supply. And because that region doesn't have a great blood supply, it means the skin is also not going to heal well. As we have developed better techniques, that incision has gotten to be smaller and smaller, and the healing has become much more reliable. Re-rupture rate is thought to be under 3% for any type of operative management. In the past decade, a new trend to minimally invasive repair has also been done. The minimally invasive technique has become quite an effective method for successful treatment of Achilles tendon ruptures. Anytime that you think that you have potentially ruptured your Achilles tendon, you should be evaluated by a trained professional who is experienced in treating foot and ankle disorders.